Hello and a very good afternoon to all of those joining me live on the Facebook page of News 9. I'm Neha. Now, our understanding of the novel coronavirus, particularly how it is behaving in India, has a new layer to it. The central government stated that 2 studies conducted on the genome of SARS-CoV-2, which causes COVID-19, suggest that the virus is genetically stable and there is no major mutation in the virus. The studies were conducted by the Indian Council of Medical Research and the Department of Biotechnology. Union Health Minister Dr. Harshvardhan very recently had also echoed the same and said that no drastic mutations have been found in strains of SARS-CoV-2 in India till now. Now, there have been concerns raised by many experts that major mutations could obstruct the development of an effective vaccine. But some recent global studies have suggested that the vaccines that are under developmental stage should not be affected by recent mutations. Many of you might be wondering what mutation is. Well, to put it in simple words, mutation is a self-defense mechanism of a virus which allows it to genetically evolve over a certain time period to mount a better attack against the antibodies in human body. To understand more in detail about this whole process, joining me over the phone line is Dr. Sitesh Roy. Very good afternoon to you, Dr. Sitesh. Now, firstly, tell us, as per the study conducted by ICMR, SARS-CoV-2 virus is showing no mutation. What does this mean?
So a mutation, Neha, is a process by which the virus either becomes more efficient in its transmission or it learns to evade the protective mechanisms of the immune system so that it can be more efficient in the infection. And these kind of mutations are very dangerous because one, a person who's already been infected could get a repeat infection if the virus mutates. And also, if we have developed a vaccine that targets a specific spike protein, for example, in the virus, and the virus changes the structure of its spike protein, then that vaccine gradually becomes ineffective. So in a sense, the mutations are something that we would be concerned about, and not seeing them in the COVID-19 virus is a good sign, and it's a good news for us and for other people around the world. There have been about 11 mutations known, but none of them have granted higher infectivity or transmissibility to the virus. And the D614G mutation, which is present in up to 97% of people who are infected now, is also a very stable mutation and does not seem to be changing.
All right. So, doctor, if you would be able to tell us, a virus that is prevalent in India and is not mutating, of course, SARS-CoV-2. So, can this understanding help us have a more targeted approach in terms of COVID vaccine and therapy in India?
Certainly. It is not just a local phenomenon in our country. It is, as we know, an international phenomenon with this virus. So even when we look at the primary mutations that are being found amongst Indian patients, we realize that those mutations largely came to us from the United Kingdom and from Dubai, where maximum number of early cases were transmitted from. And so it is not just for India, but also for the rest of the world to know that there are very limited mutations, and hence the vaccines that are being developed globally, as well as by our Indian vaccine manufacturers, will be effective for those mutations, and good news for the vaccine development process also.
Right. So, another dominant variant of SARS-CoV-2 is the D614G, which is a mutation of the virus. Since ICMR is saying no major mutation of the virus is taking place, then what about the D614G, which was witnessed in many people across India?
So, always in a virus's evolution, there is a particular mutation which comes up as dominant or comes up as most prominent, because the D614G instituted certain spike protein changes that made this virus more efficient in transmission from person to person. However, the good news was that it did not make the virus more fatal or more risky in terms of death. And hence, this virus has taken hold within our community and other parts in Europe, US, and other parts of the world, because it is transmitting very efficiently from person to person, more than the original Wuhan virus, which was the one that spread to Italy and other parts of the world was. So it's just a matter of selection. Whatever is the best of the virus, that automatically gets selected in nature and continues to propagate. And that's what we are seeing with D614G.
Right. Thank you very much, Dr. Sitesh, for taking out some time and speaking to News9. Now, there are many new things that one gets to know with each passing day about the virus and its complex nature. Of course, this new study, which is conducted by ICMR, certainly gives hopes to many. Thank you so very much for joining me. If at all you like this video, do not forget to subscribe News9 Digital. Like us on News9 Instagram, Facebook, as well as Twitter. Thank you very much for watching. Stay safe. Keep those masks up.